My definition of a social enterprise would be the end goal being able to help and actually making an impact on something. I think if you're not making an impact or making or fixing a problem, I'm not sure you could call yourself a social enterprise. Ever since I was a child, I've always been environmentally focused. There was a show in the 90s called Captain Planet, which was an environmental superhero. So that show changed me as a person. And then when I grew up, I actually realised that these things were going on in the world and it wasn't just a cartoon. So I will always credit Captain Planet. My name is Claire Lane and I'm the founder and CEO of Save Our Supplies. So we collect all the clean and usable medical supplies that hospitals throw away and redistribute them to developing nations and communities in need. My biggest challenge has been funding. In saying that, we have received some seed funding, so I've actually got a warehouse and a delivery van, and I am doing it as my job. I'm just very wary that that funding will run out eventually, so I want something more long term. Another one of the biggest challenges I think I've had is with the government. So I talked to the health department, they pass me to the waste pass me to innovation, to procurement, and we all kind of go around in circles like that. So trying to get the government to talk as one big whole has actually proved to be the biggest challenge that I've faced so far. Haven't fixed that challenge yet, but we're working on it. My background is in nursing, so in the theatre department, and it was in that job that I kind of saw day in, day out how much we actually threw away. The day that I decided to start Save Our Supplies, we wasted 3 total hip packs. So people that don't really know what goes on in a hospital, we get a whole pack for a certain surgery, and these ones were for total hips. So they come with drapes, gowns, gloves, syringes, bandages, and everything you need for a particular surgery. And we threw them away for really silly reasons, like a nick in the outside of the packet, so nothing's considered sterile. A patient was cancelled, so everything that was open got thrown in the bin. And the third one was a fly in the operating theatre, so everything's considered unsterile. And that just that didn't sit very nicely with me. And I started to ask around and basically got told that it goes in the bin, stop asking questions. It was the way it was always done. The most common supply I'm getting at the moment is PPE, because a lot of places have over-ordered from COVID. So I've actually just received 4,000 N95 masks and about 10,000 gowns. So at the moment, it's definitely masks and gowns and PPE that I'm getting a lot of. Last year, we actually got 18 pallets of hand sanitizer that was over-ordered by a company, and they were redistributed to Fiji during their COVID crisis. We try to send our supplies to where they're needed. So when Russia invaded Ukraine, everything was redistributed there. After Tonga's earthquake, everything was redistributed there. During the bushfires at the start of 2020, the Animal Rescue Collective got a lot of our supplies. So we try to keep up to where it's needed. All of our international distribution is done through the Rotary. So the Rotary has relationships overseas and they know where it's needed, so we send our supplies with them. Save Our Supplies works basically through our partnerships that we've made. So we've partnered with the Rotary. As I was saying, they've got pre-existing distribution networks and they know how to get it across. Another one that we've partnered with is Medline. So Medline is a global medical company and they help us out with picking up bins and everything. So they drop the supplies to hospitals and then they just change over the bins for us and bring it back to their warehouse, and we kind of do a changeover there. They also actually help with when I get pallets of stock. So I did actually get offered 6,000 pallets of N95 masks, which probably would have filled my warehouse 3 times over, but Medline has helped out a bit with storage of that as well. They also help with in-kind sponsorship, so we've actually got a lawyer from there, graphic designer and everyone, so they've been really beneficial to our growth. I don't think the general public has much of an idea how big this problem is, because if you're not working in the medical field, you don't see it every day. But we saved about 20 tonnes going to landfill last year, and well over $1 million worth of the supplies, and that is just the little impact that we've made with our 13 hospitals. I think once you kind of get every hospital on board in Australia, the amount of wastage and the tonnes going into landfill, which ends up with CO2 emissions as well, is gonna like quadruple.